Condolences to the families that has been affected, and also for the staff for being exposed to such a trauma. It's indeed a tragedy. So where things are now, it has been confirmed that the two patients that were shot at, they passed on, and one of the patients, the family has been informed, and the other, they are still locating because doesn't have a permanent address. It has been confirmed that the patient who did the shooting was taken to the central police. It's still there. That was the patient that was already discharged early in the morning, that was waiting for the transport, taking him to Vescas, West Coast. We just got confirmation now that the police officer who was there, noting that the police officer was not guarding in any of these, was in another cubicle. It's a surgical ward, male and female, but he had an altercation and then went to check what was happening. So we just received a confirmation that after he underwent emergency surgery yesterday, he also passed on. So at this stage, we are confirming 3 people now who have passed on. The patients also, they're undergoing counseling. Although it's normally about, it's a 26-bed ward, 40 bed, 40. There were 26 patients at the time. And this happened at the time that there was a handover, the day staff coming in and the night staff coming out. So this is how things are at this stage. In regard to whether there were any psych patients, no. They were all surgical patients. The one who's a shooter actually underwent some also minor operation and so forth, but was already discharged around that. But of course, they will undertake the psychiatric evaluation, which is part of the package. Anyway, that's how things are.
Since last night, less than 12 hours ago, hearing the news, it's devastating. And earlier this morning, it being confirmed that the officer in the line of duty also succumbed. And I want to send my sincere condolences to the families of those that have lost their lives. Whenever I hear of any cop that is killed in the line of duty or off duty, my heart goes out knowing that they are there to protect us, to serve us. And in these circumstances, I am glad that the South African Police Service was quick in securing the scene, in approaching the hospital, and the nurses, all the staff that were here on duty, they are the real heroes here today as well, who have been able to talk down the killer, the shooter. And it is devastating. And we are in a moment in time when we can reflect back and say that yes, there is, within our society, there is so much more that we need to do. And by that whole of society approach that the Minister is leading in terms of what we are doing in health and in community safety together with the South African Police Service, I firmly believe that we are going to look back and see that we are continuously wanting to make strides, and we are making strides, but this is deeply devastating.
What can be done, Minister, to make sure that hospitals are places of healing and safety and not the violent scene that we saw here now?
This is definitely not a norm. It is, the circumstances is further being investigated, but it's not a norm. So in terms of what we do in our hospital services with the securities and together with having the South African Police Service that can play their role, but this is definitely not a norm. And we are doing everything in our power in order to ensure that those that come to any hospital, to any government facility, feel safe and secure. We are doing it in our schools and across government departments. So this is definitely not a norm.